Hey guys, welcome to my channel. So today I wanted to talk about my surgery date and the exact procedure that they're gonna do. First, let me apologize for the lighting being off. I'm suffering a really bad headache right now, so I need the room to be dimmed somewhat, but I really wanted to get this video done, especially in my little area that I have here. This is my bed, of course, because I cannot move. So I apologize for the lighting being off, but I wanted to get this video done, and the steps leading up to the surgery. So this is my little area. I have my little jack reef that my best friend made for me. She's like been an amazing support for me, and she made that for me, so that hangs above my head now. Okay, so let's get right into it. Alright, so I am having a gastric bypass, but it's going to be modified for my situation. My surgeon, it's going to be 3 procedures in one, with the possibility of a 4th thing being done at that moment or afterwards. So from what I was told by my surgeon, my pouch is going to be modified to be a little bit bigger than a normal bypass patient. So for a normal bypass patient, they take away about 90% of the stomach. I'm going to have less. My pouch is going to be bigger and able to hold a little bit more food in it, because the whole goal of this is not for me to lose weight, somewhat, but it's not meant for me to lose drastic amounts of weight like that, since gastroparesis already takes away a lot of weight, off of us. That's what she's gonna do. So the first part of the surgery is gonna be removal of my J-tube and resection of my intestines. She's gonna cut a portion of my small intestines, off, and remove the feeding tube that I have now. That's going to be the first part. The second part of the surgery is going to be the actual gastric bypass. She's going to make my pouch bigger, and then put sew the intestine to that, and then sew that to pretty much like my esophagus, so that food can just like travel straight down, and hopefully that would help. The third portion of the surgery is putting a G-tube into the stomach that's left in the body, because since I still have gastroparesis, I'm still gonna bloat. I'm still gonna make bile, and I'm still gonna have excessive amounts of gas. So she wants me to have something to be able to get relief from the pain, because I won't be able to throw it up anymore. So the G-tube is going to be placed for that, for me to be able to vent. Okay, and venting is just pretty much releasing the air, releasing bile, whatever's in my stomach that's causing it to blow up and causing pain. The fourth possible part of the surgery is removal of the gastric stimulator that I have. She's not 100% if she's going to have time to do that, because she doesn't want to keep me under anesthesia for, too long. She doesn't know if she's going to do that at this moment. They may just remove the stimulator cords that are in there that are attached to the stomach. So she's probably just going to remove that. So that's a 4-part, surgery. She wants to try to do it in as little time as possible. Right now, we're looking at a 4-hour surgery. She's not sure, though, because from what she was explaining to me, the surgeon that did my J-tube told her that it was very tough to put in my J-tube, because I have a lot of problems with my stomach and scar tissue and stuff, so it was a problem. So I know that this surgery is not going to be easy. So my surgery date is set for May 1st. I still have about 2 or 3 appointments before that, because they want me to do labs again. They want me to do an EKG, and they also want me to have a pre-op appointment with my PCP doctor and the PA that works with the surgeon to make sure that nothing's changed, nothing has gotten worse, you know, that nothing has made it impossible for me to have surgery. So I'm gonna have a busy month, but it's gonna be worth it at the end, I'm hoping. My surgeon was very honest with me and told me, though, that because of all the complications I've had with all the other treatments that they've given me, there's a chance that this might not work. And if it does not work, this is the last treatment that I have. This is my last option for relief of gastroparesis. If the surgery does not work, then I will go back on a feeding tube until I can no longer do that, and then possible TPN after that. It's steps, though. It'll be the last treatment that I'll have. Everything else after that will just be to give me a little bit more, not quality, but a little bit more quantity of life, pretty much, you know, giving me a little bit more time on this earth. You know, there's been so many deaths in our gastroparesis community since January. Like, I've totaled maybe about 15 to 20. It's rough, you know, it is rough dealing with this illness, because it slowly does kill you when you get to the severe part of it. They say it's not progressive, but it is. I went from having moderate gastroparesis to severe gastroparesis within 6 months. It is progressive in my mind, you know, in the way that I feel about it. And it's taken so much, you know, so much, but I still walk around with a smile on my face. I still walk around with positivity in my mind that everything is going to work out for the way that it needs to work out. The reality of this illness right now, this is what it is. Yes, I look fine while making this video. My pain level right now is at an 8. It's always at an 8. Okay? I'm suffering a headache right now, which is why I'm in dimness and darkness in a sense. You know, I cannot move from my bed. These last 2 videos that I've made, I've done them from my bed, except for the Spoonie Essentials box that I did in my son's room, because I wanted to make sure that everybody can see. And I was in extreme amount of pain then, you know, but I don't show it because I just feel like no one's going to understand. But if I don't say what's bothering me, if I don't say the amount of pain that I'm in on a daily basis, if I don't speak up and say what's bothering me and making stuff bad for me, no one's going to know. No one's going to understand how bad this illness is at the end of the day. I am terrified of this surgery not working. I am accepting. I've accepted the fact of whatever's going to happen, but there's still fear in me. I'm human, you know. I'm going to have emotions. I'm going to be emotional about this. No one at the age of 38 thinks that they're going to have to plan for the possibility, okay, of not living another 2 to 3 years. I've just seen so many people caught off guard by the death of their loved ones from gastroparesis, and they weren't prepared. I've prepared myself already. My husband knows what I want. You know, my children know what I want. Everybody is understanding of what I want. And I've also taken into account what they want. And no one at the age of 38 thinks that that's going to happen. No one at the age of 38 or any age thinks that they're going to be diagnosed with an incurable illness that is going to possibly... Now, I'm not saying this happens, but it possibly could take your life. I've seen a lot of deaths in the gastroparesis community. No one thinks that they're going to have to live on a feeding tube to sustain them. I mean, this is the reality of this illness. And a lot of us put a mask on of a smile and try to think positive. And then we're told, you're not sick enough. You're not, oh no, you can't be as sick as you claim you are. Look at you. You know, you look healthy. You look good. And the reality of it is that we're not. And this is the reason why I make these videos. This is the reason why I'm so adamant about being an advocate for myself and everybody else, and making sure that people understand our YouTube videos, if we make them, are not going to always be perfect. They're not going to have makeup on. We're not going to look beautiful all the time. We're not going to be in good spirits. This is what it's about. This is what advocating for yourself is about. You need to let people know the good and the bad of it, you know. And I'm sorry that I ranted a little bit at the end of this video, but I just needed people to understand that I get frustrated because no one really understands our illness, and everybody's constantly telling people chronically ill, invisible, you know, with invisible illnesses, you can't be this sick, you look good, you do this. That's because we put a mask on. That's because we want people to understand that yes, we are sick, but yes, we have our moments of good days. You know, we don't only have bad days, we have good days too, and we're trying to be positive, and we're trying to carry on with life and be happy. And that's pretty much what it is. We're just trying to be happy, dealing with an illness that's taking us slowly. And yes, a lot of people may tell me, but it is not cancer. You're right, it's not cancer, but it still is killing us slowly. It's still starving us to death, which in my eyes sometimes makes it much worse. So as I said before, my surgery is May 1st. I've detailed the description of the surgery. It's not a typical gastric bypass, you know. I'm sorry I ranted at the end of the video, but I needed to get it off my chest. I hope everybody has a good day.